So, welcome to today's talk, and we will talk today about autism and homeopathy, and how in homeopathy we approach the cases in autism and the fantastic results that homeopathy has in autism. So, let's try to understand what is autism and how we work on it. So, basically, autism is a developmental disorder which is characterized by many difficulties in social interaction, communication, repetitive behavior, restricted behavior. And often these qualities, features are seen gradually. And very often we also see children who have these problems right from their childhood. Sometimes it can often happen that they develop this after 2-3 years of age. So it's a spectrum. There is no fixed rule to it. It's important to know that as of 2015, autism is estimated to affect 24.8 million people in 2015. There can be many symptoms. Now here I'm talking about symptoms because I know many of parents here who are watching this webinar may feel there are only one or two symptoms, but it can be anything. There can be impairments in social interaction, in communication, restricted repetitive behavior, sometimes even type of eating. And that is why the diagnosis of autism is often difficult in the initial phase. Let's talk one by one. And social development. For example, one of the first things that are often seen with autistic children that I have seen clinically is that they respond very less to stimuli. So if you take their name again and again, they don't respond much. And for example, one of the patients who I was treating for autism, there was just no eye contact. He would not look at you, not look at parents. His age was 5 year old. With homeopathic treatment, slowly, steadily, it took about a year and a half, but the eye fixation improved. Even simple movements, very often they are not able to do. Some autistic children are not able to even smile properly. Some people are not able to interact with different people. Often they are the one of the often things that parents tell me about autistic children, that they say that he's a loner kid. He's in his own world. In Hindi they say अपने दुनिया में ही रहता है. This very commonly that they say. And they can either have no interest, like you can see in the image here, and they could just be doing one thing. They may want to sit alone. They might often have a kind of unfeeling towards the sibling. Sometimes there's a detachment with parents also, or detachment with one of the parents. But generally, one of the first things that parents come to know about autism is communication. That most of the children who have been diagnosed of autism, the main problem has been daily communication, delayed onset of talking, gestures, patterns, vocal patterns, combination of words, consonants, gestures and words. This is often one of the other things that I've seen, and you can see this on the picture. They are unaware of this environment. They don't know where they are, what they are doing. Yes, this is also a very strong thing that I've seen. Repetitive behavior. Like one of the patients would constantly do this hand. They call it hand stimulation, constant stimulation, hand flapping, head rolling, body rolling, lot of restlessness. One of the child, I would ask him, "How are you?" and he would keep repeating, "How are you? How are you? How are you?" It's also a very strong feature of repetitive behavior. This flapping is something that I've seen in many Indian kids with autism. One of the child who had autism would keep looking at the fan ceiling for a very long time, and He had a lot of fear within him. He responded very well to a homeopathic remedy named as stramonium. Compulsive behavior. For example, checking things, hand washing, keeping the hands on the head. One of the child would keep his hand on the genitals constantly. Would be such a embarrassment for the family members. The homeopathic remedy that I gave him helped him deal with this. Another thing, like you can see here in the image, they would line up the toys. They would keep the toys 1, 2, 3. It is very subtle to diagnose autism, so it's important for you to find a good homeopathic physician to do this. There's a very important thing about autistic children which I've seen. Most of their features intensify after a change. After change in either their residence, some room, something is changed, grandmother shifts the house, some change in the routine. I've seen this, and it's important to tell to the homeopathic physician there. They don't like change. Ritualistic behavior, they would almost deal the whole day routine, same. One of the autistic children wouldn't like to change the clothes so often. Fixations about a television program. One of the child would keep on singing the same songs again and again. So, I'm giving you a lot of important things of how I'm seeing the autistic children. They may not show any interest in toys. One of the child would do self-injuries, and no allopathic medicine helping. Homeopathic medicine, tarantula helped. Head banging, ripping the clothes. Many of the autistic children don't understand the importance of pain, for example. Toe walking, fine motor deficit. So it's a spectrum. Clumsy behavior, they would often fall down. So one of the often parents ask me, is there a cause? Now, to be totally honest with you, there is not a clear cause, but it has been seen more in today's times than 50 years back. So we have to do something to do with our lifestyle of the mothers, maybe the genetic changes, but still this is at a theoretical level. The diagnosis, there is autism spectrum scoring that needs to be done. Failure to meet one of these is generally autism. We call it clinically. No babbling by 12 months, no gesturing by 12 months, not a single word by 16 months, no two phrases by 24 months, and any loss of language or social skills at any age. Management. One of the first things I often tell is avoid sugar, wheat, and milk. This often helps a lot. The allopathic doctor often suggests antipsychotics, which I don't. Homeopathy has brilliant results in this. How does homeopathy act? Your question. Homeopathy acts at a much deeper level. Very, very deep. Let me give you an example. So this is a case, a 6-year-old child who came to see me, and she had autism spectrum disorder. Her main thing was sudden flapping of hands, feet. She wouldn't have any eye contact, unable to mix with the world. She would keep looking here and then she would keep looking at the fan. For 2 years she didn't go to school. They were contemplating of changing this thing for her education, what to do. But one of the things that I saw was very peculiar about her. In homeopathy, it is important to know individual peculiar symptoms. That she was very sensitive to music. And whenever there would be music, she would start dancing. Very rhythmically. Sometimes suddenly. Sudden noise would affect her a lot. Then I also analyzed the mother's history during pregnancy. This is very important, mother's history during pregnancy. And I found out that she was very, very forced, very dominated. And that had affected her a lot. And she would feel as if kind of force against her will. And in many autistic children, we have understood this mother's history during pregnancy is very important. In homeopathy, I analyzed the case. And this is a remedy I gave. It's a remedy in homeopathy known as sepia, the main symptom being undertake thing opposed to intention. and I gave CPR 1 and potency. In 6 months, there was remarkable change. Her flapping reduced by 70%, eye contact improved. She was able to mix. Now, almost 4 years apart, she's totally changed as a person. She recently gave her exams and she came third in the school. She started doing dancing, Bharatnatyam. So, remarkable change. Homeopathy is just fantastic for this type of results. Homeopathy can make a difference to your child's life. So, find a good homeopath and show your child's case to him or her. This is my email ID. You can write to me. My clinic is in Mumbai, in Dadar, and this is my homeopathic channel. Connect to me.